System, formerly known as Middleborough Community Hospital. Just real briefly, want to go over a quick agenda of what we're going to cover today. First, I'm going to talk about population health and the shifts that we're seeing within Hillsboro County. We're going to talk about where we were as an organization and where we plan on being moving forward in order to address these needs. And through that, our partnerships with physician care services as well as medical associates.
So as far as population health goes, we looked at a few different areas that we want to address. The first one is health education. We want to promote health education in the Hillsboro County community. We think it would be wise to educate them about health and empower them to take control of their own health status as well. We also looked at behavioral health in the community, which is the modifiable behavioral risk factors, such as exercise, diet, and tobacco and alcohol usage. And so we looked at that in the community and think that's something that should be addressed. And same with preventative health services such as immunizations and screening. We think those can be improved in the community. And then as far as mental health goes, we see a very big lack of mental health services in the community. Access to those services is not great, especially as it pertains to inpatient and emergency mental health services. So we wanted to focus on that for the population. And then these areas are being challenged because of the population shift. The population in Jasper is increasing. It has now surpassed that of the population of Middleborough. And with this shift, we're seeing a lot of gaps in access to care in an already fragmented system. In addition, the population is aging. So currently, 8.8% of the population, which is 55 to 64 years, which is the light blue part of the chart, and 18.8% is over 65, which is the orange part of the chart. And I know those numbers are different from the numbers they just gave, and to be completely honest, it's a discrepancy in the book. If you calculate them by yourself, you get one number, and if you go with the numbers they give you, it's a different number. I can't answer why. It's just the book. And so as the population continues to age in the next 10 years, we're going to see a shift in diseases towards more chronic ones, cardiovascular diseases, and those that come with an aging population. So our mission as Middleborough Community Hospital is to serve the healthcare needs of Hillsboro County by providing affordable and quality services. So as it stands, we're in one location. We're in Middleborough. We're a community hospital with 272 beds, but we're only operating at about 240 beds. We're comprised of a 215-person medical staff. We have 16 acres of land, and adjacent to our land is our medical office building, which houses most of our physicians. We have meaningful use of our electronic health records, and unfortunately, we also have a lot of excess non-urgent use of our emergency department.
All right, so now we're going to talk about where we're going as an organization. The first thing that we started with was rebranding ourselves from Middleborough Community Hospital to Hillsboro Community Health System. And we feel like by making this change that we are better reflecting our mission of serving the community of Hillsboro as a whole. So our next focus is our EHR system. We recognize that we have a really strong EHR system, and we want to continue to make this available for collaboration and integration with other healthcare organizations. As Sydney said, we also recognize that mental health or access to mental health services are definitely a need. So right now we have excess beds, so we thought we would designate about 20 of our beds to developing an inpatient mental health unit. We also know that health education is a program that we already have, but we want to expand on this program and reach out to churches because we saw that we have kind of a religious community. So if we expanded to churches, maybe we could reach the population better. We also want to continue advocating for enhanced patient access. So we want to do this by ensuring that any citizen that currently does not have access to healthcare services, that they can have access to our services, along with any patients that are any citizens that are eligible for insurance through the marketplace, that they are properly enrolled in that. And last, just continue to expand our footprint. So not only have we done this by changing our name as for the whole Hillsboro community, but also we've also done this through our various partnership agreements. So here's a map of Hillsboro County, and here's where we are expanding.
Our first partnership is between Hillsboro Community Health System and Physicians Care Services. The cornerstone of this partnership will be a new facility that will be built on the Middleborough County on our Middleborough campus. PCS will lease the land from us and will be built through a joint venture to build and equip this new facility. This new facility will be rebranded as PCS at Hillsboro Community Health System, and will also have all of the other facilities that they currently operate be co-branded with that name as well. We'll be offering several new services at this new facility, including physical therapy, occupational therapy, respiratory therapy, and speech therapy. We'll also have an outpatient specialty pharmacy, an outpatient mental health service, which will be operated by PCS, an inpatient mental health service, which will be operated by us, and we'll also be providing monthly OBGYN care to all of PCS's present locations. We also intend to further integrate ourselves with PCS through PCS's physicians gaining admitting privileges at the Middleborough campus, expanding the hours of operations for PCS, and providing diagnostic equipment in existing PCS locations and integrating EHRs with PCS.
So we're currently experiencing a pretty serious misuse of our emergency department. Only about 7% of the care that we provide in our emergency department is for actual emergency care. Even worse, 54% is for non-urgent care. We expect with our partnership with PCS to be able to cut down on the non-urgent use of our ED pretty significantly in order to provide more proper utilization of our facilities. All these other new services that we are providing with PCS, basically we just want to create a continuum of care for our patients. We want to provide better quality, and we want to help generate a new source of revenue for ourselves. And finally, we're really looking forward to offering greater continuity of care for our patients by integrating our EHR with PCS and by expanding this co-branded continuum throughout other areas in Hillsboro County.
We're also pleased to announce that we've reached a formal agreement with Medical Associates, in which we will bring our expertise in inpatient services to the Jasper community. This will entail a joint venture to build a new medical center that will begin in phase 1 with 50 beds and offer outpatient as well as inpatient services. It will fall within our new brand of Hillsboro Community Health System, and it will be a joint operating agreement between the two parties. Excuse me. We will continue to integrate our EHR to better streamline patient access and records so that we can eliminate medical errors and eliminate duplication of services. The medical associates physicians will continue to staff the facility as well as maintain their admitting privileges at our current Middleborough location. We feel that in order to best meet the needs of the community as a whole, we must keep our flagship organization open.
And as Tyler just said, our partnership with Medical Associate will be built on two main pillars. One of them is, of course, our electronic health record, because it's one of our strong points. We have been awarded with the maximum financial award for the meaningful use regulation for the last 2 years. And we strongly believe that it is one tool that allows us to provide better health outcomes, and because it will allow us to provide more accuracy in diagnosis, more coordinated care, increase our efficiency, and reduce cost. And the other pillar of our partnership will be, of course, the new building. The new building will be in Jasper, and will help us to answer the shifting trend to the population from Middleborough to Jasper. And of course, it will be a newly built facility which will be, of course, cutting edge from a technological point of view.
So we're very excited for what the future holds for Hillsborough County and Hillsboro Community Health System as a whole. Thank you for your time, and we'll open the floor to questions. Okay.
Does the board have anything for Hillsboro Community Health System?
I have a couple questions. Very nice presentation.
community. But it's certainly something that we'd love to talk about with Jasper, the Gardens at Jasper, a little more.
Also, with our therapy services will be staffed by MDs, so those will be available if necessary.
Did you have another question?
My other question was, you will be creating a lot of new services in Middleborough. You're going to be also offering services in Jasper. But will the increase in services that you're offering in Middleborough with the plateauing or decreasing of the population, is that going to match population needs? Seems like population growth is all in Jasper.
And that's why we decided that it was best for us to expand our footprint into Jasper. I think with our services that we're adding in Middleborough, that's to better help our patients utilize the correct services. No patient wants to go sit in the emergency department for several hours with a non-urgent issue. So our partnership with PCS will create an avenue for them to better get care that is appropriate for their level of need.
And does PCS, they have enough psychiatrists already, or will they have to recruit new
I
physicians?
believe that it's going to be a recruitment process.
I think that's all I have.
In the discussion of the inappropriate use of the ED, looking at your psych patients, what is your plan for those patients according to the pilot study?
Currently, with the mental health issue, the patients are coming to the emergency department, and prior to our inpatient mental health facility, they would be waiting in the emergency department for hours, some it said even days, and then they'd be transported. The nearest inpatient facility was in Capital City, and so that just wasn't feasible. With having an inpatient mental health facility and a partnering outpatient mental health facility with PCS, we suspect that there will be way less non-urgent use of the ED as it pertains to mental health. But we'll also be able to better serve those that do have emergency issues.
So now with that, just so I'm clear, you're gonna just open the beds that you are not operating, that you're licensed for, and turn those into inpatient psych?
The board had previously thought about making single occupancy rooms just to increase our competitive nature and make us more marketable, and we thought those beds could instead be better used for inpatient mental health.
So PCS will lease land from you guys to have like your physician practice there.
Yes.
So like a Monday through Friday, 8 to 5 kind of thing.
We'll still have longer hours than that.
Oh, okay. Psych hours? That's usually from like midnight to like 2 or 3 o'clock. Full moon. It's a full moon. It's a full moon. It's a full moon. Yeah, everybody all hands on deck. Oh, it does say expanded hours. Sorry. Great job.
Does anyone else have any? I thought you might, Dr. Kelsey.
A great presentation, and again, I think I just need some clarification, and I'm gonna probably put on a CFO hat here when I'm talking to you. Okay, so at your Middlesboro Hospital right now, you're operating 240 beds, right? With building the Jasper facility, is that going to take inpatients away from the Middlesboro? Are we attracting people from Jasper right now as inpatients?
The Jasper population is already seeing, there is some from that are traveling to our Middleborough campus, but there's also a significant amount of the population that's leaving Jasper to go to Capital City. So we hope to retain those patients and keep them more within our system.
I think our main thrust with the Jasper facility is to make sure that we capture an expanding population rather than a shrinking one.
Okay, so we'll lose a few of the inpatients and we'll make it up.
Yes.
Over in Jasper. Okay, the psych patients that you've been mentioning, that we're gonna build these services around, are they insured?
Some of them are right now. I mean, they're the same page. It's the same payer mix. Right now, the psych services available are very much so centered in Capital City. There isn't much in the book about them, to be honest. So we don't know too much about the mental health population, except that they're not being served.
Okay.
But
You
I
know,
think they're the same
You
payer
know, I mean,
mix.
it would be, have we talked to maybe the state or something about this? Because to build our facilities around taking care of this population, if they're not insured, are we gonna have the money to be able to do that?
We already have an existing facility. It's not like there will be no services being offered, but we don't anticipate it being an extremely high expense, especially considering the other things, some of the other expenses that we have. It's not a large part of it. And we think that really what this is looking at is the benefit to the community. We're still a community organization, we're still a nonprofit, and we want to stay dedicated to our mission, and we feel like that is within our mission purview.
Right, but you know, there's a saying, no margin, no mission.
And do you really know that it doesn't cost more to take care of the mentally ill than it does some of these others? Did you do some research on that? How are you?
We've looked into that, but at the same time, they're driving up costs in our emergency department as well. So we're expecting that some of the decrease in costs there will help compensate for the increased costs that we'll incur by opening an inpatient mental facility, an inpatient department. We looked at some of the costs, but at this point, there's nothing else being offered to the community, and it's in their best interest that we open it. And hopefully our partnership with PCS with an outpatient mental health unit as well will help that continuum of care.
I had a question about that as well. Did you consider like a common, letting the PCS run both the inpatient and the outpatient? And I guess the pros and the cons of that? Or
We're just doing the inpatient, they're the outpatient, but with the continuum of care and being so close by, we're expecting that if their psychiatrist or psychologist experience an issue that would present a need for inpatient mental health, they would refer them over to us and vice versa.
And keep in mind, their physicians are going to have admitting privileges at our facility, so oftentimes they will be still involved in the patient care if a patient was moved from the outpatient services into the inpatient.
I just have one comment. I really liked how you guys addressed population health, but I work for the health department and we do a lot of population